Let's talk about the first letter in our primary assessment for trauma care, which is our A for airway and alertness. So, the first thing you want to do when a patient rolls in is you want to check if they're alert. If they're alert, this means that they are able to protect their own airway. If they are unconscious, it probably means they're unable to protect their own airway. So, what do we do if they can't? Let's go through our airway. Hi guys, so I have my lovely mannequin Charlie here. Charlie has been around the block. So I'm going to show you the two major or airway adjuncts that we utilize to keep our patient having a patent airway for us. Those two are going to be your NPA or your nasal pharyngeal airway. The other is going to be your OPA or your oropharyngeal airway. Both can be used to, like I said, maintain a patent airway on your patients until a potential further intervention needs to be done. Main difference besides the placement of the two of these is going to be gag reflex. You cannot use the OPA or the oropharyngeal airway on a patient that has a gag reflex. You can on a patient that needs an NPA. So, how to properly measure and insert the NPA? You're going to properly measure by going to the NPA. It is going to be measured from the tip of their nose or their nostril, and then it's going to go to the tip of the earlobe or the angle of the jaw. That's an appropriate size setting for this patient. You would get some water soluble lube, and you are always going to do bevel to the septum. This is the bevel right here, and you're going to put it either kind of upside down on the snares or right side up on your nares here, and then you're going to just go straight back. If you meet resistance, you don't want to forcefully put it in. You can kind of maneuver that around and try to slide it in. Charlie here is a little difficult because he's been used and abused throughout his lifetime, but it should set nice and even to the nares. And the other great thing about this is you can put an oxygen or nasal cannula right over this to deliver oxygen. When it comes to your OPA, to measure your OPA, you're going to go from the corner of the mouth to the angle of the jaw. So this is slightly big on little Charlie here, but we're going to use it to just show you. Two basic techniques to do this is using a tongue depressor to open and hold their tongue in place and to go straight back. It should sit nice and flush at their mouth. Or you can go um, either 180 degrees, and that's not for use of children under the age of 12, but 180 degrees till you reach the back of the soft palate and then turn it around this way. Once again, should be flush. If you're using oropharyngeal airway, you need to prepare for a more definitive airway in this case, but you can use your BBM to go over and oxygenate the patient while you're waiting for supplies to be set up for that. So that is your basic oral airway adjuncts. We'll go a little bit more into intubation and definitive airways later on.